Now, we will continue the second part of the lecture. We will talk about the anatomy of the female genital tract. The external genitalia, it involves the vulva. The vulva includes the mons pubis, the labia majora and minora, the vestibule, the clitoris, and the greater vestibular gland. The labia minora divided anteriorly to form the prepuce of the clitoris. Posteriorly, they fuse to form a fold of skin called the fourchette. So we will have the posterior fourchette, which is the anteriorly located to the anus. The clitoris is a small erectile tissue of 1 centimeter length. It contains 2 crura and covered by muscles. It is supplied usually by high innervation. And this picture shows to you the anatomical parts of the vulva. The vestibule is the cleft between the labia minora, the urethra, ducts of the Bartolini glands, and below the hymen. The vagina usually open into the vestibule. So, the part between the hymen and the external opening of the vulva, we call it the vestibule. We have 2 bilateral Bartolini glands. These are mucus-secreting glands, and this secretion usually secreted or stimulated during sexual relation to act as a lubricant. It has 2 ducts opened posteriorly below the hymen in the near posterior fourchette. The hymen is a thin fold of mucous membrane at the vaginal opening with the vagina open through it. Through it, the passage of the blood of menstruation occurs. The blood supply to the vulva is from the internal pudendal artery, sensory innervation from pudendal nerve S234, and lymphatic drainage usually to the inguinal lymph nodes. The internal reproductive organs involve the vagina. It is a fibromuscular canal lined with stratified squamous epithelium, non-myelinated. Its posterior wall is about 9 cm longer than the anterior one, which is 7 cm. It has 4 fornices. Its wall is in a pose position except in the vault where they separate by the cervix. That's to say, the cervix enters into the vagina. It creates 3 or 4 folds in the upper part of the vagina. We call it fornices. We have 2 lateral fornices, 1 anterior and 1 posterior. And usually the vaginal wall is one against the other. That's to say, one opposes the other. The vagina, moist by secretion from the uterus, cervix, and some lining of the vaginal wall, is rich in glycogen, especially in reproductive life, with some rugae in its wall. We have normal flora, which is the protective flora. We call it dodeline bacilli or lactobacilli. These are normal commensal of the vagina, and they break the glycogen, produce lactic acid, and this acidic media is the protective one against infection. The pH is about 4.5. This picture shows to you the anatomical position and shape of the vagina. The urethra lies anteriorly open into the vaginal wall. Laterally, the vagina is related to the cardinal ligaments or cervical ligament, and below to it, levator and nail muscle and the ischiorictal fossa. The vagina is under the effect of the estrogen. At birth, the pH is acidic because of the estrogen from the mother, and then it changes into alkaline in the pre-pubertal period. Once puberty started, the media will change into acidic again due to secretion of estrogen and progesterone, and then after menopause stoppage of these hormones, the alkaline media return back again. Blood supply of the vagina is from vaginal branch of internal pudendal artery with anastomosis from uterine, inferior vesicle, and middle rectal arteries. The uterus is a major reproductive organ. It is a hollow inverted pear-shaped organ of about 7.5 centimeter length, 5 cm width and 3 cm thickness. The non-pregnant uterus, the weight of it is about 70 gram, 50 to 70 gram. The cavity of the uterus is inverted triangle with the tubes open in its upper lateral parts. It consists of 3 layers, the outer thin, which is called the serosa, the middle thick muscular, which is the myometerium, and thin endometerium composed of columnar epithelium. And this picture shows to you what we mentioned about the shape of the uterus and its layers. The upper part of the uterus is called the body, and this is the body of the uterus from the fundus to the lower part of it, or the corpus of the uterus. The entrance of the tubes in the angles bilaterally, this area we call it the cornua, and part above the cornua is the fundus, and this is the fundus. The uterus tapers down to an area which is the isthmus, just above the cervix, and this is the isthmus, and this is the cervix. This area of the isthmus will develop in pregnancy to form the lower uterine segment. It is supported, the uterus is supported by the pelvic diaphragm, the pelvic organs, and 4 pair sets of ligaments. We have the round ligament, which travels from the anterior surface of the uterus through the broad ligament through the inguinal canal, then terminate in the labia majora. Its function is just to direct the uterus into an anteversion. It has no much support for the uterus. We have the major supportive ligaments, which is the uterosacral ligament. It arises from the sacral fascia inserted into the posterior inferior part of the uterus. It is strong mechanical support for the uterus. It contains autonomic nerve fibers. We have the cardinal ligaments or transverse cervical ligament extended from lateral pelvic wall, inserted laterally to the cervix and upper part of the vagina. It has a major mechanical support and to prevent uterine prolapse. The broad ligament passes from the lateral pelvic wall to the side of the uterus and contains fallopian tube, round ligaments, ovarian ligaments, nerves, vessels, and lymphatics. It is weak supportive ligament. Infundibular pelvic ligament, it is continuous tissue that connects the ovary to the pelvic side wall. It contains ovarian artery, ovarian vein, ovarian plexus, lymphatic vessels. The blood supply of the uterus is from the uterine artery, which is a branch from the internal iliac artery.